Good morning. Are you guys still with me?
Yes.
All right, I am so happy to be in Harlem, but it's cold. And I'm not from here. I don't know if you can tell by my non-accent, but I'm from Florida. And I want to thank Black Health Matters and Rosalind Daniels and our whole team for just letting me be here. I am truly living out my purpose, and I am just so grateful, you guys. So thank you so much for putting this on. Yeah, you can give them a hand clap. And I also want to thank Lupus Research Alliance for all they do in the lupus community, and especially today for being a sponsor of this event. Thank you so much. You know, I hope what I say today makes an impact on you. I don't want it to be just an emotional impact either. You know how we see those movies and we feel sad and we walk out and we're like, oh yeah, okay. And you forget it the next day. No, I want you to understand what lupus is about, and I want you to make some actionable steps to making an impact. And it was gonna be my first Valentine's Day as a married woman. And I had it all planned. You know, we were gonna go to Tampa that night, we were gonna have a nice night, but I noticed some things going on in my body. I noticed that I had some inflammation going through my body. My body felt like it was on fire. It's a pain that I've never experienced before. But what would you do? Wouldn't you just pop some Tylenol and call it a day?
Yes.
That's what I did. I took like 3 or 4 Tylenol that day, and nothing changed. The pain was still there. And so that's when I got a hint that something might be wrong, but I'm still 26, remember that. And I'm like, okay, you know, whatever. Let me just get through the workday. It'll be okay. I'm probably just stressed, you know. So by the end of the day, the pain had not gone away. The Tylenol, this, you know, what I thought was going to work, did not work. And so I said, you know, what can I do to, you know, stop being so stressed? Stop being so stressed. What are you stressed about? It's your husband, you know. I booked a massage. Was that the best thing for me to do? No, it was not. At the end of the day, inflammation was spread through my body. By the time I got on the table, I was bad. By the time I got off the table, it was much worse. I could barely walk out of the clinic that day. It's crazy. By the time I got to my husband, we had to go to the ER. We had to go. I said, babe, we can't do Valentine's Day tonight. I gotta go to the ER. 4 days later, the doctor still had absolutely no idea what was going on with me. Only thing that they knew was that I was severely dehydrated and that my white blood cell count was out of whack. Just a few months later, I was able to see my doctor, primary care physician, because I didn't have one at the time. Yeah, even though I had insurance, so you know, again, that's just a young mistake. Thankfully, he was an Hispanic doctor, and I say that not to exclude any other doctors, but when our doctors see us, they have a better knowledge of what's going on with us because they have a population of minorities that they treat. And I'm so thankful to him because he was able to make the connection that this might be an autoimmune disease. It might be autoimmune related. In fact, he said it was a connective tissue disease, which means it's autoimmune related, but it's not specific yet. Now, it took another 3 or 4 months for me to see a rheumatologist. I don't know if you know this, but there's not a lot of rheumatologists in America. They are very few in between, and it's a long wait time, and I'm hoping that someone like Martin Luther King has a dream that they want to be a rheumatologist because we need better treatment and to get in our doctor's office sooner. But when I talked to her about my symptoms, she also agreed that it might be autoimmune related. And so what we did was, we did a full blood workup, and we did something called an anti-nuclear antibody test to see if it would test positive. So just a few months later, she was able to say that, yeah, you indeed have lupus. It was a devastating diagnosis and one that I didn't take as seriously as I should. But I'm hoping that by me educating you guys and giving you a brief education on lupus that you will take it seriously. First, let's get a little bit more familiar with the disease. There are 3 types of lupus: systemic lupus, erythematosus, say that 5 times fast, is the most common lupus. It's the one that involves all of your body. And when I mean all of your body, I mean from head to toe, lupus can affect your body. There's cutaneous lupus, the ones that have rashes or lesions of the skin. There's a drug-induced lupus. And with this one is when your doctor prescribes you a medication that might present lupus symptoms in you. When you stop taking that medication and isolate which medication is causing those symptoms, usually it will go away. And then there's neonatal lupus. There's also rashes that look like butterflies. There's raised red patches. There can be photosensitivity involved, another marker of lupus due to sun. A lot of my sisters, first off, you need to know that lupus can affect women mostly from 15 to 44. This is something that I'll repeat to you so you can remember. But think about when we want to go out to Florida's beaches, we always need to wear sunscreen and like that, but many of my sisters have to wear wraps, hats, things that you wouldn't really see at the beach, but because there's photosensitivity, you have to stay under umbrellas. That's, what we have to do if we want to enjoy the beach. We have a little bit more limitations than a normal person. There can be mouth or nose ulcers and arthritis in 2 or more joints and swelling. Here's some real-world examples of how this has affected me, because I really don't want to just throw symptoms at you. I think it's going to help you to see what this looks like in real life. So I don't know if you can see my arm, but what I'm going to do is just, so you can know, take off my jacket here. This just happened this year. Now, I've had lupus for about 9 years, right? So I've had scarring here. It was raised in red like, one of the 11 markers, but now I don't know if it's in the healing stage or in a hyperpigmentation stage, but this is what's happening. So a lot of, I was presenting this on Instagram because I was like, I need my sisters to help me, and I say that's definitely lupus. Even before I got the biopsy back, they said that's definitely lupus involvement. Here's the funny thing about this. This is what I call moon phase. This happens when you have a certain high dosage of prednisone, which is a blessing because it helps with the inflammation, so I'm able to be here with you today. But it also gives you a lovely moon face. My face is not that swollen. This is what happens when you take a lot of prednisone, just to calm down inflammation. You're gonna get a frozen, like a filled swelling face like this, okay? And here's my meme that I saw today. Now, fatigue. It's not so much the joints for me. A lot of people have joint involvement. I only have joint involvement when it's really cold outside. Like today, I felt like the Tin Man walking out. I was like, ugh, it's gonna be a little crazy today. I feel it when it's damp outside, if it's really humid, which is common for Florida, yippee. And when my hormones change every month, I'm sure you know what I'm alluding to. Now, the fatigue is what is a real big issue for me, because it's like I try to do things during the day, but I'm too tired, and this is correct. At 9 p.m., I'm ready to go. Now, that's so backwards, isn't it? Yeah. So fatigue, and you can ask a lot of lupus patients, it's the fatigue. It's the fatigue. I always ask, what is the most common symptom in lupus that really bothers you the most? Is always the fatigue, because it stops us dead in our tracks. It's crazy. So when people tell you if they have lupus, that they're tired, please believe them. Please believe them, because there are times in between before I was diagnosed, I couldn't get up off the couch. It was truly a struggle just to get off the couch and go take a shower, feed myself, nourish my body, do everyday things, go to the grocery store. And even now, I do one major activity. This is my one major activity today, and the next is to get myself to the airport so I can make it home safely. That's it. That's all I'm allowing myself to do. I might go to lunch with a friend, but it has to be nearby. These are the things that I have to consider as a lupus patient, whereas, I'm so busy in my mind, I still have energy in my mind. I want to go do all the things, and I can't do that. There's also some more markers that we should talk about and touch on. Inflammation of the heart. This is what Toni Braxton is dealing with. pericarditis, seizures and psychosis, renal, hello, blood disorders, anemia. I also have anemia, and that's probably what I was dealing with in the hospital. Antibodies to double-stranded DNA, that's some scientist stuff, I'm telling you from a patient perspective. And anti-nuclear antibodies, which we talked about, positive ANS test, and the absence of drugs known to induce it. So, another thing is hair loss. Now, this is not my hair. I don't want to fool y'all. This is Marley hair, okay? But I used to have locks down to my waist, and they couldn't hold on. My hair is just falling out, you know, on the stairs, and you know, it was that heavy on my head that it just couldn't hold on because of the hair loss. So that's that, and then you have to find some humor in a 26-year-old buying stock in Aspercreme to rub down on her joints to make everything okay. But you know, that wasn't it. I thought that, you know, maybe dealing with that would be it. You know what I'm saying? I wish I could say that was my journey, but as you now know, in 2010, I was diagnosed with kidney disease. And that's lupus nephritis. That's what I was diagnosed with. So think about this timeline. July 2009, I'm diagnosed with lupus, which rocked my world. And in 2010, now I got kidney disease? That's a pretty aggressive disease. I'm just trying to give you a timeline on how fast this thing can move. So now I'm on dialysis. Before, I was going okay. I was able to exercise. My doctors were able to get me to a good rate that I could do that, you know, keep my kidney function steady. But May 2016, I landed in the hospital again, and I was there for about 4 days. And they just could not get my kidney function from stopping. The toxicity that was going on was too much. And they had to give me a high dose of prednisone again to be able to get it down, and they finally released me. And my doctor at that point was telling me, you really need to think about dialysis as an option. And again, that denial kicked in. I'm like, oh no, you know, doc, I can beat this. Let me get my green smoothie on, you know what I'm saying? Let me eat a kale salad or whatever, you know what I'm saying? Thinking that was gonna do it. And I'm not saying that having a great diet and exercising is not going to help you, but we gotta be real. Sometimes we just gotta take the medicine. And my medicine was dialysis. And I really held out until like November 2016, but it was to the point that when I was in church, I couldn't worship like I wanted to. God had to really wake me up, okay? I said, hey, what's going on here? You can't stand up without breathing heavy. You can't worship the way you want to. You can't clap your hands, you can't sing. And now you can't walk back to your car without feeling like you're gonna pass out. That was my wake-up call. That now, at 4% function, yes, 4% function, that I need to get dialysis. And so now, not to get too personal, but here's my catheter right here. You wouldn't know unless I told you that. So, you know, we need to get over that stigma. But like I said, many are worse off than I am. Here's some statistics for you. 9 out of 10 lupus patients are women. So now, we're bringing it back to the backyard, you guys. 40 to 50% will have organ involvement. That's a high percentage. More often than not, you're gonna have organ involvement when you are diagnosed with lupus. And they say that there's 1.5 million people in the US living with lupus, and we think that's a conservative estimate. Because when you die and you have lupus, lupus is not on your death certificate. Lupus won't be on my death certificate. It will be kidney disease. If you have heart involvement, it will be heart disease. Another part of the body, it'll be that. And so we definitely need a better way to track lupus, but 1.5 million is a lot, and considering that's conservative is a shame. So like I said, systemic lupus is the most common lupus, and just as systemic is our lack of awareness. This is in our own backyard. 2 to 3 times more diagnosed than white women. That's us. That's African Americans, that's Asian women, that's Pacific Islanders. That's us. This is not a distant disease that doesn't impact our community. It's right here, it's right next to you. In fact, let me see. How many people know anybody in their circle with lupus? Wow, I was not expecting that. Wow. So you know that this is right next to you. How many feel like they know a lot or enough to educate somebody about lupus? Wow. Yeah, so my purpose is here. I know I'm in the right place because we have people around us who are suffering from this disease, but we're not educated on how to support them. Now, this is why I'm so passionate, if you can't tell, because I know there's work to do. I know there's work to do in our own backyard. Tony Braxton, Nick Cannon, Selena Gomez, she recently came out with having to have a kidney transplant, and I was blown away because I didn't even know, I don't think anybody knew until she really came out with it that she had lupus. And then the next year, felt like she had a kidney transplant. I'm like, wow, that was quick. And then there's Lady Gaga, who I think has dedicated an album and is working with the Lupus Research Alliance to bring awareness to. And then there's Lupus Research Alliance and National Institute of Health and Lupus Foundation America and all these organizations that are doing their part in outreach. But I bet if I ask each and every one of them, they'll say it's not enough. It's simply not enough. I say that people like you and I are the ones who make the impact. We are the ones who are the foot soldiers and on the front lines of spreading awareness about this disease, asking for funding and more research about this disease. Look, I know where I am, Harlem, right? We got some activists in the house, I'm sure. We got people who are in the streets for different causes. And in the past years, the Black community's voice has been heard like never before. We're making a difference. And now it's time to make a difference in our health. I don't know why we tend to slack in this area, but advocacy starts with self. We must speak up about a disease. We know about diabetes, right? We know about HIV, right? We know about heart disease, right? Well, now we need to know about lupus. And that's why I'm here today, to put this on your radar, that this needs to be something that we're informed about. So, like I said, you know now, I believe you're advocates. I believe you're advocates now. You know a general awareness of what lupus is. And so now I'm challenging you. What can you do? First, be informed. Be informed and educated about lupus. Know how to support the people in your lives. It's amazing to me how lupus has affected us, just the people in this room. Educate yourself. Know the symptoms. Look at your friends and see, something's weird about her, what's going on? I'm gonna suggest you go to the doctor and get a full blood workup, and you must ask for a full blood workup and make sure an ANA test is involved, because if you don't, you're gonna miss it. 2, be a myth buster. Hey, you know when somebody says something about your friend and it's not true, and you're like, oh no girl, that's not true, and don't talk about my friend. If you got a problem with it, you go talk to her. This is how I need you to be about lupus. Lupus is not contagious. Lupus is not HIV. I don't want anybody to have a stigma. I'm not trying to stigmatize anybody with HIV or is HIV positive. But there's rumors out there in the Black community that this is HIV, and it is not. The only thing that is common among this is autoimmune related. That's the only thing. So we need to dispel some myths in our community. And we need to talk about medication. Now, Dr. Johnson, God bless her, thank you so much for mentioning those clinical trials. We need to get involved in some clinical trials. And I understand the feelings about that, because America has a past about testing on African Americans. I know about Tuskegee and the syphilis test and everything like that. But we can no longer say that we need a cure to a disease and we're not a part of the research. How? How can that happen if we're not a part of the research? So we need some brave souls, and unfortunately, this thing has done such a damage to me that I'm not really helpful in that realm. But if I could, I would. That that we need to be a part of some clinical trials. I know Lupus Research Alliance, on their websites, they have trials that are available and accessible that people can participate in. I know there's different organizations out there that have various clinical trials that you can find the one that matches you and your issues. It's time to step up. We can't be afraid of what's going to happen. We have to be brave in this way, because if we are, we'll be able to test the worst case scenarios, because we are the worst case scenarios. Black women, more severe, like I said, 2 to 3 times more affected, more diagnosed than Caucasian women. And our men are even more, even though they're 10%, they have more severe symptoms, even though they get diagnosed less. If you're diagnosed as a man, you're gonna have more severe symptoms, most likely. So I'm just asking you today to be involved. Reach out to lupus chapters in your area. I know there's some organizations here, right here in Harlem, that will help you. Be informed, be a myth buster, and go to the Lupus Research Alliance table and ask them, what can be done? What can I do? Take a brochure, start small. I'm not asking you to have an L on your chest and be a lupus hero and fly all around the country. I wish I could, but responsibilities and priorities. But doing the most you can in your own circle is the best you could ever do. So thank you so much, and I appreciate you listening to me, and now it is time for questions.